Good day everyone, I'm Mark Casal from the BSN 1M7A. So today, I'll be performing a return demonstration about cold compress and hot compress. Now, to demonstrate the proper technique in applying hot and cold compresses, ensuring patient safety and comfort, while achieving therapeutic effects such as pain relief, reduction of inflammation or swelling, or the improvement of blood circulation. For step 1 to 6, same procedure in patient for hot and cold compress. Step 1. Verify the doctor's order for the cold compress and hot compress, including the type of moist, cold and hot application, location and duration, and the desired temperature. Step 2. Review client's chart for medical history and contraindications such as poor circulation, impaired sensation, or vascular disease that may contraindicate cold and hot compress. Step 3. Gather all the materials near the bedside. We have here the gloves, the washcloths, the waterproof pad, the basin with warm water, the alcohol, and the compress bag with ice. Next, we need to perform hand hygiene and apply clean gloves. Next, we need to greet and identify the client using 3 identifiers. Good morning, Ms. Flores. I am Marcus, your nurse for today. May I verify your full name, your birthday, your age? Now, can I check your wristband? Next, we need to provide privacy at all times. Since we are in a private room, I already closed the door. However, in some instances in ward, we will close the curtains. Next, we will now proceed to the cold compress procedure. The first thing that we will do is to assess the client and family's awareness understanding of the procedure and related safety factors. Ma'am, have you or anyone in your family ever received a cold compress before? After asking that, we need to explain the procedure to the client clearly and completely with client's approval. Now, ma'am, I will explain the procedure to you. The doctor ordered a cold compress to help reduce the swelling and relieve the pain in your knee. Now, cold compresses are generally used for recent acute injuries with swelling, inflammation, or pain, and for reducing fever. They help by numbing the area and slowing down the blood flow to the injured area. Now, we'll leave it for about 15 to 20 minutes. Would that be okay with you? Next, we need to assess the vital signs and mobility. I already assessed the patient's vital signs and mobility earlier. Everything is within normal limits and she is safe for the procedure. Next, we need to identify the expected outcomes. Ma'am, I will now clarify our goal is to reduce the swelling and make your knee feel more comfortable and less painful. After that, we'll describe the sensation the patient would feel and precautions to prevent friction and or numbness. Ma'am, I will describe the sensation that you may feel it is a bit cold, some tingling, or slightly numbness, which is normal. But if you feel intense cold, pain, or burning, please tell me right away so that I can stop the procedure. Next, we need to position the patient in bed. Kept the affected body part in proper alignment, exposed body parts to be covered, drape patient as needed. Ma'am, I'll help you now po to position your legs slightly elevated and keep the rest of you covered for warm purpose. Is that okay with you po? After that, we need to assess the client's skin around the area to be treated and the client's temperature and pain sensitivity. Next, we need to inspect for any wounds. So ma'am, there are no wounds or open skin in the area, so we're clear to proceed. Next, we need to place a waterproof pad under the knee. So ma'am, I'm placing a waterproof pad under your leg to protect the bed linens and prevent moisture. Next, before I apply the cold compress to the affected area, I will check the temperature of the cold compress, then we will apply it. So ma'am, I'm now applying the cold compress. Let me know if it feels too cold or uncomfortable to reduce inflammation and pain. So next, we need to monitor comfort and observe skin during application. So, ma'am, how does your knee feel now po? Okay, that's good po. I'll check your skin po every 5 minutes and observe your reaction closely. Please let me know po if anything feels wrong and to avoid po yung injuries like frostbite or the skin irritation. So, I'll be back po after the 5 minutes. Thank you po. It's been 5 minutes now. I'll check the temperature of the compression bag. Now, if needed, remove, remoisten, and reapply to maintain the cold temperature. Since the cold compressed bag with ice is still the same temperature, we will not remoisten it. If any untoward incident or problem occur, then stop the application immediately. Now ma'am, I'll be back at 20 minutes to recheck feedback. So ma'am, it's been 20 minutes now and I'm now removing the compress and drying your skin to prevent prolonged exposure which can damage your tissue. Next, we need to inspect the skin post-treatment. So ma'am, your skin looks normal, no redness or irritation. Do you feel any improvement? Next, we need to clean and store the equipment. After that, we need to help the client to a comfortable position. Now, ma'am, I will now cover your knee and I will be repositioning you in a comfortable position. After that, we need to remove the gloves, dispose of properly, and perform hand hygiene. So now, let's identify unexpected outcomes. So ma'am, there were no unusual findings or adverse effects during and after the procedure. After that, we need to reassess the vital signs. So I'll recheck your vital signs to compare with earlier readings. So your pain scale earlier po is 7/10. Can I ask what is your pain level for today? 2/10. So now, let us document and report. So ma'am, thank you for your cooperation po. If you need me or anything po, just call me on a call bell. Thank you. Now, I'll be demonstrating a written demonstration about hot compress. First of all, we need to perform hand hygiene. Next, we need to assess the client and family understanding. So now po, I will assess your family understanding so that I have awareness on your indication about the hot compress. Have you or a family member used it before? Okay. Next, assess the vital signs and mobility. I already assessed the patient vital signs and mobility earlier. Everything is within normal limits and she is safe for the procedure. Next, we need to identify expected outcomes. So ma'am, our expected outcome is to reduce your back discomfort, relieve muscle tightness, and promote better circulation to help with healing and to evaluate the effectiveness of the hot compress. Next, we need to explain the procedure and gain approval. So Ms. Flores, I will explain the procedure to promote understanding and your cooperation for the entire procedure. Your doctor prescribed a warm, moist compress to your lower back. Let me explain why. Hot compresses help by relaxing muscle and reducing stiffness, and relieving chronic pain or discomfort. However, there are times we do not use heat therapy, such as when there is an open wound, impaired sensation, or has poor blood flow in the area. Is it alright for me to begin po? Next, we need to describe expected sensation and safety precaution. So this is the expected sensation that you will feel and to be aware and safe during the entire procedure or the treatment. You might feel warmth, mind tingling, or relaxation in the area, but if you feel burning, stinging, or numbness, please inform me right away. The compress will stay on for about 15 to 20 minutes. I'll be checking info with you every few minutes. Next, position the client in Sims position and ask for permission to expose her properly. I will now expose the area where the hot compress will be applied. So ma'am, I will help you into a comfortable position for the procedure. Is it alright if I adjust your clothing and expose only the area where the hot compress will be applied? I will make sure po to keep the rest of your body covered with privacy. Next, we need to assess the client's skin and temperature sensitivity for any signs of redness, irritation, or loss of sensation, then inspect the wounds. However, there is no open wounds. Next, place a waterproof pad under the treatment area. So ma'am, I'm placing a towel under your back to keep your bed linens dry. Next, we need to apply the washcloth to the warm water of the basin and wrung out the excess to avoid dripping water, then apply it to the patient. So ma'am, I'm applying the hot compress now. Let me know if it feels too hot or uncomfortable to reduce inflammation and pain. Next, we need to monitor comfort and observe skin during application. So ma'am, how does your back feel now? So that's good. I'll check your skin every 5 minutes and observe your reaction closely. Let me know if anything feels wrong and to avoid hot injuries like first-degree burn or redness or skin irritation. So I'll be back after 5 minutes. So ma'am, it's been 5 minutes po. I will check the temperature of the towel. Then, if needed, remove, remoisten, and reapply to maintain the warm temperature. Since the hot compress is still at a warm temperature, we will not remoisten it. If any untoward incident or problem occur, then stop application immediately. So ma'am, I'll be back po after 20 minutes to recheck. Thank you po. So ma'am, it's been 20 minutes. I'll now remove the compress to prevent overheating and gently dry your skin. Next, we need to inspect treated area post-procedure. So ma'am, I'm now checking your skin again. So no redness, no irritation. Did the compress relieve your discomfort? Next, we need to clean and store the equipment. After that, provide privacy and reposition the patient. Ma'am, I will now cover your back po and I will be repositioning you in a comfortable position. Then, remove gloves, dispose of properly, and perform hand hygiene. After that, identify unexpected outcomes. So ma'am, there were no signs of burn, skin reaction, or an adverse effect. Next, we need to reassess the vital signs. So I'll recheck your vital signs again po to compare with earlier readings. So your pain earlier is 7 out of 10. Can I ask you what is the level of pain now? Over 10. Lastly, document and report. So ma'am, if you need anything, just call me on the call bell. Thank you po.